The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Okay, let's go to pharmacology. So, number 121, what change can be expected in the dose-response curve when naloxone is given in opioid overdose? And the correct answer is C, shift to the right. Okay, bakit? So, recall naloxone is a competitive inhibitor of opioids. So, let's discuss competitive versus non-competitive inhibitors. What's the effect on the dose-response curve? For competitive inhibitors, it's shift to the right, which is indicative of a decreased potency and unchanged efficacy. How about non-competitive inhibitors? There's a downward shift indicative of a decrease in efficacy and no change in potency. Okay, so as you can see here in the figure on the left, you can see the effect of a competitive antagonist. There's a rightward shift, meaning you would need more amount of drug to produce the same effect. That's the rightward shift in competitive antagonists. Doon naman sa right, the figure on the right, you can see the effect of a non-competitive antagonist which causes a downward shift. Ibig sabihin, yung efficacy ng drug mababa na. Okay? Let's go to 122. A patient in the ophthalmology ward is given a topical mydriatic for a fundoscopy. 2 hours later, they develop hyperthermia, lack of sweating, delirium, and tachycardia. What drug was likely given? And in the choices, puro mga cholinergic, anticholinergic drugs, no? So first you have to determine, is this cholinergic or anticholinergic poisoning? Sabi, sweating, delirium, tachycardia, parang mad as a hatter, red as a beet, hot as a hare, Alice in Wonderland, which is indicative of anticholinergic poisoning. So, among the choices, alin dyan ang anticholinergic? Let's look at it. Letter A, tropicamide, non-specific anticholinergic. Letter B, donepezil, cholinergic. Neostigmine, cholinergic also. And oxybutynin, M3 selective anticholinergic. So, as we mentioned earlier, this is anticholinergic poisoning. So, we are left with choice A and D. But, oxybutynin is M3 selective. What's M3? M3 is for glands lang. But, look at the patient. Merong tachycardia, delirium. So, very widespread yung effects. So, this must be due to a non-specific anticholinergic drug poisoning, which is tropicamide. Okay? So, let's look at anticholinergic. Alice in Wonderland, hot as a hare, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. Okay? So, how about cholinergic poisoning? Dumbbells, diarrhea, urination, meiosis, bradycardia, emesis, lacrimation, lethargy, and salivation. So, when you think of cholinergic, parang very messy, no? Lahat ng secretions lumabas. Diarrhea, urination, lacrimation, etc. On the other hand, anticholinergic naman, Alice in Wonderland. Hot, dry, red, blind, and mad. So, how will you remember? Minsan kasi nakakalito, is this anticholinergic or cholinergic? So, when you think muscarinic or cholinergic, think makalat. All your secretions come out. And tropa ni atropine, trops are usually anticholinergic. So, tropicamide, ipratropium, tiotropium, tropa ni atropine. Okay? 123. Which of the following drugs primarily act to increase outflow of aqueous humor via uveoscleral veins in treating glaucoma? So all of these drugs are used in glaucoma, but which one is used to increase outflow? Let's look at the choices. Timolol, decrease production. Brimatoprost, increase outflow. Acetazolamide, decrease production. And mannitol, decrease production. So the correct answer is brimatoprost. Okay? Let's look at the drugs for glaucoma. In general, those that cause increased outflow, cholinergics like pilocarpine, physostigmine, and prostaglandin like latanoprost and brimatoprost, and alpha agonists like epinephrine. Whereas those that cause decreased production would be beta antagonists like timolol, osmotic agents like mannitol, and carbonic anhydrase inhibitors like acetazolamide. This is a very high-yield question. Maraming ophtha, pharma. Okay? Let's go to 1 to 4. What side effect is more likely to occur with treatment with spironolactone than with eplerenone? Spironolactone and eplerenone are both potassium-sparing diuretics. But eplerenone has less effects on the androgen receptor. So the correct answer is D, gynecomastia. So spironolactone has more effects on the androgen receptor compared to eplerenone. Therefore, spironolactone typically causes gynecomastia. Okay, let's discuss potassium-sparing diuretics. These include aldosterone inhibitors. Examples are spironolactone and eplerenone. Remember, aldosterone is a derivative of cholesterol. And cholesterol is lipid-soluble. Therefore, yung mga kamukha ni cholesterol like aldosterone, spironolactone, and eplerenone, they also work on the steroid receptors, including the androgen receptors. And that's why spironolactone has a strong effect on androgen receptors aside from the aldosterone receptor, thereby causing gynecomastia. And the other potassium-sparing diuretics are epithelium sodium channel inhibitors, particularly amiloride and triamterene. These are very important kasi onti lang yung potassium-sparing diuretics. K stays with K-sparing diuretics, spironolactone, triamterene, amiloride, and eplerenone. Okay? A patient is on digoxin for heart failure. He is on several other dyslipidemia and heart failure medications. He had a digoxin level which showed subtherapeutic levels. What drug could have caused this interaction? Let's look at the choices. Rosuvastatin is an HMG-CoA reductase inhibitor. Propranolol is a non-selective beta blocker. Ivabradine is a sodium funny channel current inhibitor. And cholesterol is a bile acid binding resin. So which one of them has an effect on digoxin? The correct answer is cholesterol. Let's discuss. Bile acid binding resins are, they bind bile. They prevent bile reabsorption. And because they prevent bile acid reabsorption, there is low bile stores, which promotes LDL reabsorption to regenerate bile, and therefore decreasing LDL. Examples are cholesterol, cholestyramine, and cholesevelam. It can decrease absorption of many drugs, particularly digoxin, vitamin K, thiazides, warfarin, and statins. Okay? Alright, let's go to the next one, 126. What is a contraindication to giving triptans to a patient with severe migraines? The correct answer is Prince metal angina. Bakit? Let's review serotonin receptors first. Medyo mahirap to ma-memorize, but let's look at each one and their function. So 5-HT1A is involved in mood regulation. What we want to do to this receptor, we want to agonize it with drugs like buspirone. 5-HT1D is involved in vasoconstriction, and we want to agonize this with triptans. 5-HT2A, also vasoconstriction, and we want to agonize this. For example, you have a patient bleeding out, mga nag-deliver, mga buntes, di ba? Mataas ang chances for bleeding. So we want to agonize vasoconstriction using ergots to prevent blood loss. And we have 5-HT3, which is involved in vomiting, and we want to antagonize this kasi we do not want to vomit. And we will use cetrons, mga ondansetron, okay? And 5-HT4 is involved in bowel movement, and we want to agonize this in certain conditions like irritable bowel syndrome with constipation using tegaserod. So, in essence, lahat sila agonize except for 5-HT3. Siya lang yung ina-antagonize. Okay? So, let's discuss triptans. Migraines are thought to be due to excessive vasodilation in brain vasculature. Triptans counter this via vasoconstriction. Hence, cannot be used in patients with vaso-occlusive diseases as in CAD, Prinzmetal angina, stroke, and PAD. So, be careful when you're prescribing sumatriptan, ha? Okay, 127. Which of the following drugs is least likely to cause weight gain in a patient taking antipsychotics? Let's look at the correct answer. It's ziprasidone. Why? First, let's discuss antipsychotics. The first generation is otherwise known as typical. It has a higher risk for extrapyramidal symptoms because the dopamine block is way higher than the serotonin block. Examples include chlorpromazine, thioridazine, flufenazine, and haloperidol. Whereas yung second generation, considered atypical sila, they have a higher risk for metabolic syndrome. And that's because the serotonin block is way higher than the dopamine block. Examples include clozapine, olanzapine, risperidone, and aripiprazole. So how do you remember? Typical antipsychotics yung mga zine, chlorpromazine, thioridazine. Yung mga atypical naman mga pin, olanzapine, clozapine, tsaka mga done, risperidone. Okay? Zip the dress and avoid weight gain with ziprasidone. Okay? Next, 128. An alcoholic patient is given a drug that, when taken with alcoholic beverages, causes severe headaches and vomiting. What drug was most likely given? The answer is disulfiram. Okay? So let's look at the management of chronic alcoholism. We have two major agents, naltrexone and disulfiram. Let's look at naltrexone. It's an opioid antagonist used for opioid and alcohol abuse, but side effects include pruritus, nausea, vomiting, and it's also hepatotoxic. On the other hand, disulfiram is an aldehyde dehydrogenase inhibitor used in alcohol abuse. Ang side effects naman niya hangover symptoms. So, kaya siya used in alcohol abuse kasi when you give disulfiram to a patient na addicted to alcohol, tas nag-relapse siya, uminom siya ng alak, it will be so horrible for this patient dahil magkakaroon siya ng hangover symptoms. So, these hangover symptoms will discourage this patient from consuming alcohol. Like, makokondisyon yung brain niya na kung mag-take siya ng alcohol, it will actually be very bad for him. And this causes accumulation of acetaldehyde. That's why we have hangover symptoms. If you look at this diagram, you can see that ethanol is transformed to acetaldehyde via alcohol dehydrogenase, which is blocked by fomepizole. And acetaldehyde is transformed to acetate via acetaldehyde dehydrogenase, which is blocked by disulfiram. So if you block acetaldehyde dehydrogenase, you will have an accumulation in acetaldehyde, very good, which causes hangover symptoms. Okay? So there are drugs that cause disulfiram-like reactions, and you can remember them with this mnemonic. Sorry pals, can't go mingle. So kunyari ikaw, inaya ka ng friends mo na uminom Friday. But sorry pals, can't go mingle kasi umiinom ka pala ng sulfonylureas, procarbazine, cephalosporins, glyceofulvin, and metronidazole. Okay? 129. What is the main mechanism of action of levetiracetam? It's A. Binds to SV2A. Okay? I summarized the general mechanism of action of anti-epileptics. Those that act on the sodium channel are phenytoin, carbamazepine, valproic acid, and lamotrigine. Those that act on calcium, pregabalin, ethosuximide, and gabapentin. Those that act on the GABA receptor, vigabatrin, felbamate, tiagabine, barbiturates, and benzodiazepine. And those that act on the SVA receptor will be levetiracetam. So here are anti-epileptics involving calcium channels, PEG, pregabalin, ethosuximide, and gabapentin. And anti-epileptics involving GABA receptors, GAB is a very fat baby. Vigabatrin, felbamate, tiagabine, benzodiazepines, and barbiturates. 130. A patient with atrial fibrillation is started on an anticoagulant to reduce the risk of strokes. She insists that she is keen to start on medications but does not want repeated blood tests. Which drug is best to give? And the answer is apixaban. Bakit? Let's look at antiplatelets versus anticoagulants. So this is a table or a graphic from Katsung which summarizes drugs used in clotting disorders pretty well. Let's discuss antithrombotics. Anticoagulants are those that include indirect thrombin inhibitors like heparins, direct thrombin inhibitors like rudins, gatrans, factor 10A inhibitors, yung mga sabans, apixaban, and 1972 inhibitors, which include warfarin. Antiplatelets naman include GP2B3A inhibitors, yung mga FIBs, tirofiban, and then yung mga ADP inhibitors, yung mga CLOPs, yung mga GRELs, clopidogrel, prasugrel. PDE3 inhibitors include cilostazol, and thrombolytics include yung mga alteplase, reteplase, streptokinase. And among them, yung hindi kailangan ng routine monitoring is yung mga 10A inhibitors, yung mga sabans. Warfarin kasi, heparin, mga gatran, they require routine monitoring ng mga PT-INR. Okay? 131. A patient with long-term rheumatoid arthritis develops gradual shortness of breath on exertion and fine crackles on auscultation of her lungs. What drug most likely caused this? And the answer is methotrexate. Why? Drugs causing pulmonary fibrosis ban me. Bleomycin, busulfan, bromocriptine, amiodarone, nitrofurantoin, and methotrexate. Ban me. Okay? 132. What is an indication for giving desmopressin? And the answer is hemophilia A. Okay, let's discuss. ADH agonists. ADH agonists promote water and salt reabsorption. Do not give this in SIADH, syndrome of inappropriate ADH secretion, kasi excess na nga yung ADH mo, dadagdagan mo pa. And do not give this in congestive cardiac failure dahil ang dami mo nang fluid, dadagdagan mo pa. But it can be given in central diabetes insipidus in which ADH is deficient, but not in nephrogenic DI. Kasi sa nephrogenic DI, maski marami kang ADH, unresponsive na yung kidneys mo. It can also be used in hemophilia A because it acts on extrarenal receptors to increase von Willebrand factor, which stabilizes factor 8. Remember hemophilia A? Factor 8 deficiency, diba? Let's go to 133. A G2P1 female at 8 weeks of gestation has Graves' disease. What antithyroid drug should be given to her? The answer is PTU. Why not the others? Carbimazole and metimazole can cause aplasia cutis, and iodine 131 is radioactive and therefore pregnancy category X. So the correct answer is PTU. A type 2 diabetic is on several oral antihyperglycemic drugs for poorly controlled DM. They present to the ER with symptoms of hypoglycemia. Which drug is the most likely culprit for their presentation? The correct answer is glycoside. Why? Let's look at the mechanism of action of the choices. Exenatide promotes the incretin effect. Therefore, it is glucose dependent. Linagliptin, same thing, glucose dependent. Metformin is a sensitizer, also glucose dependent. Whereas glycoside is a secretagogue, maski walang glucose o merong glucose, it will encourage the secretion of insulin. So, kung onti lang yung glucose sa katawan mo, tapos uminom ka pa ng glycoside, lalo ka magiging hypoglycemic. Let's look at the drugs for diabetes. Sulfonylureas include yung mga clozide, clamide, pyride, Zide. And non-sulfonylureas, repaglinide, netaglinide. Ang mechanism of action nila, insulin secretagogues, increases insulin secretion regardless of glucose level. Therefore, higher risk for hypoglycemia. Biguanides, metformin, thiazolidiniones, pioglitazone, they are insulin sensitizers. And then alpha-glucosidase inhibitors, these include acarbose, miglitol, voglibose. It inhibits intestinal absorption of sugars. DPP-4 inhibitors, yung mga gliptin. And yung GLP-1 agonists, yung mga tides. Incretin-related drugs, prolongs endogenous action of GLP-1. And sodium glucose transporter 2 inhibitors include yung mga flozins, dapagliflozin, increases urinary glucose excretion. Mnemonic, urine flows with flozins. SGLT2 inhibitors cause glucosuria. Let's go to 135. Which drug is least likely to be effective in skin infections from Staph aureus? Microcrossover. Ano bang gram stain ng Staph aureus? It's gram positive, right? Among the choices, aztreonam has no activity against gram-positive bacteria. The rest, bacitracin, nafcillin, cephalexin, have good activity against gram-positive bacteria. 136. Which of the following quinolones is more appropriate as treatment for pneumonia? Let's look at the choices. Nalidixic acid is a first-gen quinolone. Levofloxacin, third-gen quinolone, more gram-positive activity. Ciprofloxacin, second-gen quinolone, less gram-positive activity. Lomifloxacin, second-gen quinolone, less gram-positive activity. So the best answer would be letter B, levofloxacin. Let's discuss. Sa cephalosporins, the higher the generation, the more negative coverage. Sa quinolones, the higher the generation, the more gram-positive activity. So, opposite sila. Cephalosporins, the higher you go, the more negative. Sa quinolones, the higher you go, the more positive. But we're talking about pneumonia. Ano bang common causes ng pneumonia? Mga Staph aureus, streptococcus, mga gram-positives. Therefore, you want a quinolone na higher generation and higher gram-positive activity, like levofloxacin. Okay? Let's go to 137. Which of the following drugs is considered cell cycle specific? And the correct answer is vincristine. Let's discuss. Okay, let's discuss the types of chemotherapeutic agents. It can be cell cycle specific, meaning they target cells that are actively dividing. And it can also be non-specific, meaning it acts on non-dividing cells, meaning yung mga nasa G0. How do you remember cell cycle non-specific agents? Cells not active are annihilated. So, cisplatin, nitrosoureas, alkylating agents, and anti-tumor antibiotics. An elderly woman with wet age-related macular degeneration is given intravitreal injections of a drug. What drug was likely given? And the answer is D, bevacizumab. Bakit? Rituximab is a CD20 inhibitor. Erlotinib is a tyrosine kinase inhibitor. Ustekinumab is IL-12 and IL-23 inhibitor. Ang bevacizumab, VEGF inhibitor. Therefore, it inhibits excessive angiogenesis in wet, age-related macular degeneration. Mnemonic, bevacizumab, BV, blood vessel. Okay? 139. Which of the following is not a known adverse effect of prolonged omeprazole use? And the answer is D, increased risk of strokes. So, it's known that it causes diarrhea associated with C. difficile. It causes vitamin B12 deficiency and fractures, pero wala siyang association with stroke. Let's talk about PPIs. It can interfere with absorption of vitamin B12, calcium, iron, and zinc, increased risk for fractures, and hospital-acquired infections. Mnemonic, PPIs equals prazoles. Omeprazole, esomeprazole, lansoprazole. H2 receptor antagonist, mga tidines. Ranitidine. Yung mga protective covering, mga S, sucralfate and bismuth salicylate. 140. Which of the following drugs can increase the risk of hemorrhage in a patient on warfarin? Let's look at the choices. Carbamazepine is a CYP activator, same for phenytoin, same for griseofulvin. Ang inhibitor lang dyan is cimetidine. So the correct answer is cimetidine. Bakit? Bakit ito yung answer? Let's discuss. CYP inhibitors. Warfarin is metabolized by CYP enzymes. CYP inhibitors cause reduced metabolism of warfarin. Therefore, nag-a-accumulate ang active warfarin and there is increased risk of bleeding. CYP inhibitors, sickfaces.com. Sodium valproate, isoniazid, cimetidine, ketoconazole, fluconazole, amiodarone, chloramphenicol, erythromycin, sulfonamides, ciprofloxacin, omeprazole, and metronidazole. How about CYP activators? Ethylbuba takes fen-phen and refuses greasy carb shakes. Ethanol, barbiturates, phenytoin, rifampicin, carbamazepine, and St. John's wort. And that's it for pharmacology. Kapit lang, guys.
Okay, so 7 down. Let's proceed to our 8th subject, surgery. So, first question in surge. So, what is the most common organism associated with pyogenic liver abscesses? It's your E. coli. Okay. So, pyogenic liver abscesses, it's the number one liver abscess in the United States, whereas in the rest of the world, it's still your amoebic liver abscess. So, it's a loculated or enclosed bacterial infection. Most commonly isolated organisms are your gram-negative bacteria. E. coli seen in more than 2/3. And here are the other possible bacteria. No? So 40%, only one microbe is isolated, 40% many, and 20% are culture negative. Pyogenic liver abscesses are more frequent in the right lobe, maybe solitary, multiple, or associated with other abdominal or pelvic abscesses. Okay, so it may cause clinical symptoms such as right upper quadrant pain, fever, jaundice, and other findings. So, definite diagnosis is culture. Treatment is usually with a long course of IV antibiotics. However, there are certain indications for percutaneous drainage or surgery and correction of the underlying associated abdominal pelvic abscesses. Okay? So, next question tayo, which is not part of the secondary survey. It's your letter A, airway and cervical spine stabilization, because that's part of your primary survey. Diba yung A, B, C, D, E natin? So the primary survey, A, B, C, D, E, is to identify and simultaneously at the same time resuscitate the patient if there are life-threatening conditions. So first, airway. So laging tandaan, airway kasabay niya lagi si spine stabilization. So you want to protect the airway while protecting the cervical spine as well. So the rest of the ABCDE is breathing, circulation, disability, and exposure. For the secondary survey naman, after you've done your primary survey, you want to identify other injuries that you may have possibly missed, okay? So the mnemonic there is ample. So you check for allergies. In terms of the history, ample. So like check for allergies, medications the patient takes, any past medical history, comorbids, or if the patient is pregnant. When was the last meal intake? Rule out risk of aspiration, and what were the events surrounding the injury. And of course, in terms of PE, it's a complete head-to-toe examination. Okay, so that's your differences ng primary from your secondary survey. ABCDE versus ample. Okay, so third question, tumor marker most useful for advanced breast cancer. Correct answer here is letter B, CA15-3. So the utility of your tumor markers, again, it's not mainly for diagnosis or screening. It's more for monitoring response to therapy. So pang follow up siya and to check for tumor recurrence. So I've listed down here some important tumor markers with clinical significance. So for example here, ALP for bone or liver metastasis, AFP for hepatocellular carcinoma and your yolk sac tumors, beta HCG, yung mga gestational trophoblastic disease, Latin, like HMOL and choriocarcinoma, which will heal more in your OB examination. So again, breast cancer may have used two, no? So CA15-3 and CA27-29. But CA15-3 has more evidence, especially in advanced breast cancer. So another thing I'd also like to emphasize, CA19-9 and CA125. So they're used for pancreatic and ovarian cancer, respectively. Calcitonin is for medullary thyroid cancer. Kasi medullary thyroid cancers, they come from your C cells, which secrete calcitonin. Other tumor markers, so CEA is also famous and it's used for colorectal, both colorectal and pancreatic cancer. And then LDH, it's also an indicator of your tumor burden and is for seminomas as well and ovarian dysgerminomas. And PSA for prostate cancer. However, note na these tumor markers may also be elevated in non-cancer lesions, such as for PSA, pwede rin siyang elevated sa VPH and sa prostatitis. Okay? So, next question tayo. 144, Meckel's diverticulum na nag-herniate. So that's your, di ba, little children. So that's your Litter's hernia. Okay? So again, so by now, you should try to familiarize yourself na and memorize these hernia eponyms kasi favorite din tong tanongin sa boards, no? So again, we've emphasized ko lang, Richter's hernia. So the antimesenteric border of the bowel through a fascial defect. Litters, again, little children, Litter's hernia. Yung rule of twos kasi ng Meckel's diverticulum. So most become symptomatic by age 2 years. So middle, may dalawang bowel loops. So 2 bowel loops in the sac. And then A for appendix. And then these two, no? Yung 2 lumbar hernias. So may isa sa superior and may isa sa inferior lumbar triangle. And then yung the left versus yung mas anterior, yung Morgagni hernia. So these are your diaphragmatic hernias. Okay? So kindly read up on this. Tapos browse through it a few hours to days before your board exams. Okay? So 5th question, most susceptible organ to blunt trauma, and is also involved in upper torso penetrating wounds. That's your liver. So the liver is the most commonly injured intra-abdominal organ during blunt abdominal trauma. And because it's also a large organ, it's also involved in penetrating wounds. So if liver is number 1 sa blunt, yung spleen naman is number 2. Yung hollow viscous naman, like the stomach, small bowels, they're more at risk during penetrating trauma kasi mataas yung surface area nila. So penetrating, increased surface area ng mga organs yung affected. So small bowel, liver, colon. Whereas blunt trauma, so di ba blunt trauma, more of increased kinetic energy. So organs that cannot yield to impact ang more likely injured. So again, number 1, liver, number 2, spleen, and pwede rin yung kidneys. Okay? So yung differences ng organs at risk for blunt and penetrating trauma. All right? Sige, so let's proceed to the next question. So what do you do if the Bethesda categorization is category 3, no? Or your atypia of undetermined significance? What's the next best step? It's to repeat your fine needle aspiration biopsy. So here's the Bethesda classification for thyroid cytopathology. So 1 is benign. 1 is non-diagnostic or unsatisfactory. 2 is benign. 3, which is in the question, it's your atypia of undetermined significance. And then 4 is your follicular neoplasm or suspicious for follicular neoplasm. 4 is suspicious for malignancy, and 6 is outright malignant. Okay, so I'd like to emphasize here for number 1 and number 3, you repeat the FNA. So non-diagnostic kasi sa una, so you're unsure, no? There's still a small risk for malignancy. So you want to repeat it under ultrasound guidance. And again, if atypia of undetermined significance, you also repeat the FNA. So for anything na follicular, pag follicular kasi, you're unsure if it's follicular nodule only or outright follicular thyroid cancer. And diba, if you remember your pathology sa follicular thyroid cancer, it requires histopathologic examination. So hindi sapat yung cytopathology only. Kailangan tissue specimen yung ginagamit. Kaya we need to do a surgical lobectomy at the minimum. Okay? And then for those with malignant, so as principles of cancer care, wide radical cure mostly, no? So you usually do a near total or a total thyroidectomy. Okay? So that was the Bethesda classification. Moving on, so question number 7. So most commonly encountered congenital cervical thyroid anomaly of the cervical thyroid anomaly, it's your thyroglossal duct cyst. Okay, again, it's the most common congenital cervical anomaly. So thyroglossal duct cysts are residual thyroid tissue left behind when the thyroid descends from the base of the tongue, so diba sa foramen cecum, until its last position in the lower neck. So 80% occur at or just below the hyoid. So in terms of symptoms, it's a midline anterior neck mass. So midline, so sa gitna siya. Compare that to your brain, brain brachial cleft cysts, which are usually more lateral, di ba? So thyroid glossal duct cyst is more midline, and your BC cysts are more lateral. Okay, brachial cleft cysts. So they also move during deglutition or tongue protrusion. So since it's a thyroid tissue, it moves when you swallow. And since the thyroid previously connected siya sa tongue, it moves also when you move the tongue. Okay? And it may undergo secondarily infection. So pwedeng magkaroon ng parang abscess like or magkaroon ng draining sinuses, which is a usual presentation if matagal nang hindi na-cure yung thyroid glossal duct cyst. And around 1% may undergo malignant degeneration. Usually, papillary yung histology. So diagnostic, so clinical pa lang, you can already diagnose it, but you also need to do TFTs and ultrasound or a thyroid scan just to rule out other possible foci. The surgical procedure of choice is your cyst trunk procedure. It involves an en-bloc removal of both the cyst, its shaft, and a portion of the hyoid. Okay? So that is your thyroid glossal duct cyst. So let's proceed. Next, question number 8. So Goodsall's rule, if a fistula in ano has an external opening located blank, it is connected to an internal opening by a short radial or direct tract. That's your, when the external opening is located anteriorly to the transverse line across the anus. So the Goodsall's rule predicts the location of the internal opening of fistula and anus based on the location of the external opening. So I like to start with yung posterior first. Kasi pag posterior yung external opening to the transverse line, no? Transverse line across this anus, it will always go curved back to the posterior midline. Okay? Now, yung change na natin is yung dalawang anterior. So if it's anterior but malapit sa anal opening, less than or equal to 3 centimeters, it will course directly, no? So parang galing sa labas, diretso lang yung linya niya to the interior. So kung ito yung external opening, it will just go diretso sa loob. Okay? However, if mas malayo yung anterior opening, it's gonna curve to the posterior midline. Okay? So yun yung exception to the Goodsall's rule. If it's malayo, more than 3 cm, it will curve to the posterior midline. Okay? So again, posterior muna memorize nyo, and then anterior na malapit, and then yung exception. Okay? Question number 9, most common complication of PUD, that's your bleeding. So GI bleed is the most common complication of your peptic ulcer disease. So ulcers are focal defects in the mucosa, and it extends deeper into the submucosa or more. So this is in contrast to erosion. So in erosions, yung mucosa lang yung involved. So versus erosions. So there are four possible complications. So number 1, most common is your GI bleed. So when the ulcer reaches a blood vessel, so pag na-reach na yung blood vessel, kakainin niya yung blood vessel, dudugo, basically. So perforation, if it tunnels through the entire viscous wall, so after the viscous wall, ano yung pupuntahan ng butas? It's already communicating through your peritoneal cavity. So may perforation, may pneumoperitoneum ka na. Okay? So penetration naman is a special type of perforation where it tunnels through an adjacent organ. Okay? Through an adjacent organ. So pwedeng adjacent organs is the pancreas, the hepatic lobe, and the colon. Okay? And the least common na complication is gastric outlet obstruction. So here, there's peripyloric edema or may strictures around the pylorus. Kaya ka magkakaroon ng pyloric obstruction. Okay? And malignancy is not a complication per se, but may be associated, no? Since gastric ulcers may risk of cancer sila. Kaya lagi, pag may gastric ulcer, you have to biopsy it on endoscopy. Okay? So, again, so erosions, these are just superficial, sa mucosa lang. Ulcers, these are more deep, no? Submucosa and beyond. Okay? So, for example, there's a blood vessel here. If it's the blood vessel, that will result in GI bleed. Okay? Pag nag-penetrate naman siya, tapos ito na yung peritoneal cavity, that's already a perforation. Okay? And lastly, if it penetrates to an adjacent organ, for example, my liver dito, that's already your penetration. Okay? So those are the complications of your peptic ulcer disease. Okay? Next question, which class of shock meron ng hypotension? alam na dapat natin to, it's your class 3 shock, okay? So there's a table in your handout. I've tried to simplify it based on the important clinical signs, the percent blood loss, and the management. So class 1, the body can still compensate. So there's almost no clinical findings. Pag class 2 na, there's already tachycardia and tachypnea. Yun yung important sign niya, tachy and tachypnea, but not yet hypotensive. Kasi sa class 3 ka pa, magkakaroon ng hypotension and oliguria. Okay? And then class 4, malala na siya to the point na there's already altered sensory. Okay, so that's a brief way to remember the classes of hemorrhagic shock. And as what Dr. Mabugat mentioned, no, yung percent blood loss, just think of tennis. So love 15, 30, 40. So 0 to 15%, 15 to 30%, 30 to 40%. And ito, more than 40%. Tapos yung masasolve mo yung value, yung exact value, by remembering na humans have approximately 5 liters, diba, of blood. So 5 liters times 40%, that's around 2,000 ml blood loss. And so for the first two, you can start your crystalloids already. So fluid therapy muna, isotonic crystalloids. And then 3, give PAC RBC. So at class 3 shock, you already consider blood transfusions. And in class 4 already, you're expecting a lot of blood products. You do a massive transfusion protocol. And sa massive transfusion protocol, we give in a ratio of 1:1:1 ng PAC RBC, FFP, and platelet concentrate. Okay? So next, so which nerve during a mastectomy, pag na ligate, you will result in loss of sensation in the lateral chest, medial arm, and axilla. That's your intercostobrachial nerve. So among all these nerves, it's the only one that is sensory. Kasi yung iba, motor. Siya lang yung sensory. So again, the intercostobrachial nerve is a sensory nerve to the medial aspect of the upper arm. It's a cutaneous nerve and provides sensation to the inner arm, lateral chest, and the axilla. It is commonly injured kasi cutaneous siya. So dun pa lang sa pagda-dissect ng planes, pwede na siyang masira. Okay? So the thoracodorsal nerve is motor to the lats dorsi, whereas your long thoracic nerve is motor to the serratus anterior. And if it is paralyzed or ligated, it will result in scapular winging. Okay? The medial pectoral and lateral pectoral man are motor to the pex major and pex minor. So again, I just also want to say this. So yung eponym ng long thoracic nerve, kasi according to Schwartz, it's also known as the nerve of Bell. Baka lang lumabas sa boards. Okay? Next, special eponymous sign for appendicitis na may pain on hip flexion. Hip flexion, that's your iliopsoas sign or your psoas sign. Okay? So the iliopsoas or psoas sign, it's pain when the thighs are extended passively or when the hips are flexed. So usually this denotes a retrocecal appendix. Yung Robsing naman, pag kinapay mo yung left lower quadrant, maramdaman ng patient yung pain sa right lower quadrant. Parang migrates, parang ganun. Yung Dunphy sign is increased abdominal pain on coughing. And another useful clinical sign is the obturator sign. So on internal rotation of the flexed hip, there's hypogastric pain. And yung implication yun is that the appendix is pelvic in location. Okay? And kindly read up na lang din on these other special signs. Kasi favorite nitong tanongin sa board exams. Okay? Next, which layer in the wall does the gallbladder lack? It's your submucosa. So the peculiar sa gallbladder, no, it does not have a submucosa. So the gallbladder, important din tong number sa anatomy, no, or baka tanongin sa surge, 30 to 50 ml yung normal capacity niya. So from the fundus, yung pinakadulo, the corpus or the body, then the neck, the infundibulum or the Hartmann's pouch, and then your cystic duct. So yung function ng gallbladder is to receive, store, and concentrate bile. And in terms of histology, it lacks your muscularis mucosa and your submucosa. So dahil wala siyang submucosa, the gallbladder is prone to have mucosal outpouchings, no? So yung mucosa, parang it's going to go down into the layers of the rest of the gallbladder wall. So you call those your Rokitansky-Askoff sinuses. Okay? So baka lang lumabas din sa patho or sa anatomy. Rokitansky-Askoff sinuses. Again, Rokitansky-Askoff sinuses. Okay? Rokitansky-Askoff. See. So again, 30 to 50 ml, walang submucosa and muscularis mucosa. Next question. Uh, ito, cranial injury na may crescent-shaped clots ba? Crescent shape, that's your subdural hematoma. Kasi ano epidural? It's your lentiform. Yung subdural naman, it's your crescent or banana shape. Okay, crescent or banana shape. So just a brief, short refresher, no, on the types of cranial injury. So epidural, it's epidural above the dura. So it's between the inner table of the skull and outer layer of the dura. And usually this mechanism of action is a fracture on the therion, resulting in a laceration of the middle meningeal artery. And again, it's lentiform, lens shape, no? Lens shape. Lemon or lens shape, parang ganun. Next is a subdural hematoma, subdural below the dura. So it's between the inner layer of the dura and the arachnoid of the meninges. And it's usually venous yung bleed niya. So it's a laceration of the bridging veins. Okay? Because the brain is compliant, it follows the convexity of the brain. Kaya siya crescent shape or banana shape. Okay? And depending on the chronicity, pwede siyang hyperdense, isodense, or hypodense. Okay? And then subarachnoid, it's bleeding within the arachnoid space itself, between the arachnoid and the pia mater. Usual causes, traumatic or ruptured aneurysms or AV malformations. So there's blood in the basal cisterns and sulci, resulting hyperdensities around the circle of Willis. Yun yung parang starfish sign, no? So if you see this, so parang may star dyan, no? May parang starfish or star, okay? So kasi may dugo sa basal cisterns. Next is intraparenchymal hematoma. This is basically your hemorrhagic stroke, no? Hemorrhagic stroke. So ito yung hemorrhagic stroke mo. So usually the mechanism is rupture of the lenticulostriate arteries or other perforating blood vessels in uncontrolled hypertension. Predilection site sa basal ganglia, thalami, and the brainstem. Okay, so irregular siya and within the brain matter itself. Intraventricular naman, it just extended into the brain's ventricles. So, yung problem here is because it's in the ventricles, it may result in hydrocephalus. So, pwedeng i-block niya yung CSF flows. Okay? And lastly, yung DAI mo. So, usually, it's in the gray matter to white matter junction. You see punctate hemorrhages. And yung mechanism of action niya, bakit nagkakaroon ng DAI is your shearing of your axons due to rapid acceleration and deceleration. So, yung classic or buzzword naman sa DAI is yung CT scan mo, clean and disproportionate sa clinical findings ng pasyente. So, kita nito, medyo malinis siya, no, compared sa iba. Pero yung pasyente mo, DCS3, hindi na magasing, kailangan i-intubate. So, that's your DAI. Okay? So, I hope that reminds you of the different forms of cranial injuries. Okay? Next, most common indication for a definitive airway, that's your altered mental status. So, di ba, as mentioned, GCS less than 8, consider to intubate. So GCS less than 8, stop muna, think, should, and decide if you will intubate. So because with altered mental status, they cannot protect their airway. So others is if there's impending or ongoing obstruction, or if the patient cannot maintain ventilation, so kailangan EMV, so you need to insert a tube. And during cardiac arrest and severe hemorrhagic shock. But AMS, altered mental status, most common. So next most common cause of appendicitis in children, that's your lymphoid hyperplasia. So ito number 1 sa child. Fecaliths naman ang number 1 sa adults. Okay? So acute appendicitis is the most common surgical abdomen. So causes, fecalith number 1 in adults, children, lymphoid hyperplasia naman yung number 1. Okay, so other possible causes, fibrosis, pag may cancer, neoplasia, foreign bodies such as mga food na nag-travel unfortunately into the lumen ng appendix, parasites like ascaris, and the curious if they undergo erratic migration, calculi, and barium. Okay? So next, last 4 questions. So, which describes TPN rather than peripheral or peripheral parenteral nutrition, that's your letter A only, 15 to 20% dextrose solution. Okay, so your TPN has higher concentration of dextrose, has higher osmolality, and because of these two, so parang very dense yung ating binibigay na parenteral nutrition, we need to administer them into larger veins capable of higher flow rates. So usually central veins. Kaya central yung pangalan niya rin. Versus yung ito, peripheral. So sa smaller peripheral veins, pwede naman. Okay? So it provides your complete nutritional requirements compared to your PPN na has lower concentrations of macronutrients and calories. Okay? And may be used for longer periods. So again, what I'd also like to emphasize is the main indication when we use TPN or PPN is when the GI tract is unusable. So laging caveat or parang rule sa nutrition in surgical patient is use the GI tract when possible. So laging enteral hanggat hindi na kaya. Doon ka lang mag-parenteral. Okay? Sige, last 3 questions. So, an early penetrating abdominal injury is a class 3 wound. Okay? So this is again from your handout. Tapos I just simplified it. So let's focus first on the progression of these findings. No. So for atraumatic and uninfected surgical surgeries where you only expect skin microflora, so walang innate na microflora sa surgical wound, that's a class 1 or clean surgery. Tapos you add the suffix letter D, so parang 1D if you leave a device. So for example, if you leave a prosthetic mesh sa hernia surgery or a prosthetic valve. Okay? Tapos, once you enter into parts of the body with innate microbes, no? So alam mong, kung sa mga hollow viscous ng GI, respiratory, and genitourinary tract, may indigenous bacterial flora sila. That's already your type 2 or clean contaminated. Okay, tapos take note lang din, colorectal surgeries are also class 2 surgeries, but they have higher risk of, innately a higher risk of infection. Okay? Tapos next, class 3 contaminated. So nag-enter ka, tapos unfortunately, nagka-gross spillage. For example, may intestinal material or food na lumabas when you did your incision, pwedeng ganun. Or if the part of the body that viscous is already inflamed. So may inflammation. Okay? But it is not yet infected. Okay? So other caveats, so if there's foreign material or new or early trauma, so mga bagong sugat na penetrating wounds, kunwari, that's your class 3 din. Or breaks in sterility. For example, yung cardiac massage, part din yun ng contaminated wound. And dirty, so may bacteria na talaga or may infection na talaga. So there's already pus or the viscous is perforated. This also includes mga old na trauma na, so that it may already be colonized and already have a lot of bacterial load there and necrotic or devitalized tissue. So yun yung class 4. Okay? So I hope that this helps know yung progression ng findings and other notes. So I'll kindly read up on this na lang. Okay? Next, so burn resuscitation, Parkland's formula, 50% is given during the first 8 hours. So again, this is your Parkland formula. So you multiply 4 to the patient's body weight in kilograms times the estimated total body surface area involved ng second or third degree burns. Again, first degree burns are not included in solving your percent TBSA. So yung total value na to, ibibigay mo over 24 hours. So 1/2 in the first 8 hours. So yun yung sagot sa tanong natin. And the rest, divide mo within the next 16 hours. Just remember, yung Parkland formula, so 3 to 4 yung ginagamit nating value. However, if the question asks naman yung latest na American Burn Association or like modified Parkland, you use a lower value na 2 ml. So, mostly naman, the Board of Medicine still sticks to the term Parkland's formula. Okay? And the last question, hypermetropia, what lens do you use to correct it? That's your convex lens. So what is hypermetropia ba? That's basically your farsightedness. Okay, so let's discuss the various errors of refraction. So pag wala kang error of refraction, perfect yung mata mo, 20/20 ka, that's called emetropia. If you're nearsighted naman, that's your myopia. So with myopia, your eyeball is too long or the curvature of your refractive surfaces, yung cornea and lens, is too much, such that the image falls in front of the retina. So for example, kasi sobrang haba na eyeball mo, yung light nare-refract towards the harap ng retina mo. Okay? Sa hypermetropia naman or farsightedness, so usually your eyeball is too short or their refractive surfaces have too little curvature, such that, so ito, short eyeball, pag nag-refract yung light, it goes behind the cornea, the retina, okay? And then astigmatism, so hindi perfectly spherical yung refractive surfaces mo, kaya there are two or more focal points. And lastly, presbyopia sa mga matatanda, there's age-induced loss of the ability of the lens to accommodate for near vision. So, sa myopia, yung gamot dyan is give your biconcave lenses. So, if it's hard to memorize, what I do is most of us will be nearsighted tayo most, no? Nang may people with errors of refraction. So what I do is I look at my glasses and I see, oh, it's biconcave. Pagpaloob kasi siya, biconcave. So by logic, that means na yung patients na farsighted, convex naman yung lenses na kailangan nila. Okay? So make it more relatable to yourself if hindi kaya. And then for astigmatism lang, that's cylindrical lenses para ibra yung degree of refraction at different meridians para maging equal yung focal point. Imbis na dalawa, maging isa na lang ulit. Okay? And for people with older, yung older, di ba, yung mga magulang natin or lolo-lola, we see them have their reading glasses. So yung reading bifocal yan. So sa lens nila, may parang small area dyan that has a different refraction to help them with near vision. Okay? So again, the eyeball is too short, kaya sa likod yung image. So you give a convex lens para mas focus yung image, ma-shorten yung focal point towards the retina. Okay? So that was surgery. Thank you for listening.
Okay, now we're doing the clinical subjects. Let's do internal medicine. Number 161. What is the best initial therapy for an attack of acute gouty arthritis? The answer is NSAIDs. Okay? NSAIDs. Let's discuss the keywords for acute gouty arthritis. Usually affects elderly men and postmenopausal women due to increased urate levels. Causes podagra as the classic initial presentation. And synovial fluid aspirate, you can see negatively birefringent, needle-shaped, monosodium urate crystals. Let's discuss treatment. Mainstay of treatment during an attack is NSAIDs, first line, colchicine and glucocorticoids. Remember, do not use allopurinol for acute gouty arthritis, ha? It's only for prevention and maintenance kapag nag-die down na yung flare. Okay? 162. Which of the following is used in the diagnosis of psoriatic arthritis? It's the Caspar criteria. Bakit? Yung SLIC criteria, SLE, BASDAI is ankylosing spondylitis. Let's look at the Caspar criteria. So, let's just look at the ones in bold. Number 1, may psoriasis. Number 2, may nail dystrophy. Number 3, negative yung rheumatoid factor. Number 4, may dactylitis. And number 5, radiographic evidence. Okay, next. Oral glucocorticoids are not used in the treatment of psoriasis because of the potential development of which of the following? The answer is C, pustular psoriasis. Let's discuss the keywords for psoriasis. Morphology, erythematous, sharply demarcated papules and plaques covered by silvery scale. Koebner phenomenon, yung traumatized area becomes new lesions. Auspitz sign, removal of the scale causes pinpoint bleeding. And oral glucocorticoids are not used due to potential development of pustular psoriasis when therapy is stopped. Okay? 164. In patients with RA, which of the following diagnostic tests is the most sensitive, ha? For detecting synovitis and joint effusions? That is the MRI. Rheumatoid arthritis keywords, wrists, MCP, and proximal interphalangeal joint. Most frequently involved. Other systems, hematologic, mga normocytic normochromic anemia, pulmonary, pleuritis, cardiac valves, usually mitral regurg. Treatment, DMARDs, including yung mga conventional, methotrexate, and yung mga biologics, yung mga anti-TNF agents. And also, of course, your steroids. Let's differentiate OA versus RA. And OA, usually, elderly, no? Tapos, ang mga affected yung mga big joints like the knee, the hip, and the hand. Particularly yung distal interphalangeal joint, no? Meron tayong Bouchard and Heberden's nodes. Usually, morning stiffness lasts less than 30 minutes and ang mainstay natin is non-pharmacologic, so weight loss, exercise. Non-weight-bearing exercises, okay? Rheumatoid arthritis, usually bata pa yan. Small joints, yung wrist, MCP, and PIP. Meron tayong characteristic deformities, swan neck, boutonniere, extra-articular manifestations like yung sa pleuritis, sa cardiac valves. And usually, morning stiffness is prolonged. And the mainstay of treatment is DMARDs. Remember the differences, ha? 165. Which of the following should be used as treatment for patients with widespread psoriasis? The answer is UV light. Remember, we do not use systemic glucocorticoids for psoriasis. Tas ang topical, hindi na siya appropriate for widespread. So the best answer is UV light. Let's look at this. Topical steroids only for localized, UV light for widespread, pati methotrexate for widespread. And again, no oral glucocorticoids. 166. A patient was brought to the ER for severe DOB. COVID swab revealed a positive result. Intubated for desaturation. Septic, no? And he was then admitted to the ICU for closer monitoring. What is his COVID severity classification? Na-intubate na ICU na, critical na yan. So, let's look at the COVID classification. Mild, no signs of pneumonia. Home quarantine lang. Moderate, may signs na of pneumonia. Takip-nik na, 21 to 30, pero ang SATs mo greater than 92. COVID facility lang yan. Kapag severe, RR mo 30 and above na. Saturation mo, ang baba na, less than 92. ICU na yan. Tapos ang critical, kapag na-intubate mo na, pag nagva-vasopressors ka na, and septic na yung pasyente. Okay? Which of the following malarial parasites may lead to cerebral malaria? The answer is P. falciparum. Yung falciparum, very malala. Okay? Let's look at the malaria keywords. Cyclic fever, chills, and diaphoresis. Tas ang severe and fatal complications from falciparum malaria, cerebral malaria, malaria hyperpyrexia, and black water fever. Diagnostics include thick and thin blood smear. Gold standard yon. 168. The following characteristics are indicative of myocardial ischemia except C. Radiation to the trapezius. Let's look at ischemic versus non-ischemic chest pain. Ischemic chest pain tends to be sudden and progressive, provoked by an activity and including extreme emotions. And it may or may not respond to sublingual nitroglycerin. It's usually described as squeezing, tightness, and heaviness. Parang may elepanteng nakaupo sa dibdib mo. It radiates to the upper abdomen, shoulders, arms, wrists, fingers, neck, and throat, but not the upper jaw. And it usually lasts more than 10 minutes. If 30 minutes na, probably ACS yan. Kung 10 minutes, CCS. How about non-ischemic chest pain? It's usually predictable, no? Associated with meal intake, changes in position, and it has no response to sublingual nitroglycerin. Described as burning, pleuritic pleasure, tightness, and colicky pain. And right upper quadrant radiation, pwedeng cholecystitis. Kung sa trapezius naman, baka pericarditis. And the timing is variable. Okay, so remember this, a very high yield sa clinics dahil maraming patients na inaatake sa puso. 169. What is the most common pulmonary manifestation of RA? It is pleuritis. 170. What drug used in RA can cause irreversible retinal damage? This is a recall question and the answer is hydroxychloroquine. Okay? What is the first defense against hypoglycemia? It is A, decreased insulin. Let's look at the responses to hypoglycemia. At 80 to 85 mg per dl, you would want to decrease insulin. This is the first defense. At 65 to 70, you would want to increase glucagon, no? Why? Because you want to promote gluconeogenesis. You want to generate glucose that will go to the blood. And you would also increase epinephrine and cortisol and growth hormone. At 50 to 55, you would start the behavioral defenses including symptoms, yung panghihina, and kapag less than 50, himatayin ka na. Okay? 172, a patient came to the ER with chest pain that was eventually diagnosed to be STEMI. On auscultation, patient had mid-basal rales with positive S3 and S4. BP is 110/80. What is the Killip classification? It is class 3. Why? Let's look at the Killip class, no? Class 1, normal BP, no symptoms at all of heart failure. Class 2, may moderate heart failure ka na, pero normal pa rin BP mo. Let's look at the Killip classification, no? Class 1, no rales or signs of pulmonary or venous congestion, also normal BP. Class 2, meron ka ng moderate heart failure, that's why you can hear rales na, tas may S3 gallop and tachypnea. Class 3, severe heart failure na, so aside from S3, may S4 ka pa. And class 4, shock na. So 1, 2, and 3, normal pa yung BP mo, pero there are increasing signs of heart failure and pulmonary congestion. Class 4, shock na. Bale, mababa na yung BP. Let's look at this mnemonic. Killip scoring. 1, none. 2, tachypnea. 3, atrial and ventricular gallop. Because remember, S3 is atrial gallop and S4 is ventricular gallop. 4 is hypotensive. Okay. Let's go to 173. Which of the following will present with heart failure with reduced ejection fraction? The correct answer is A, coronary heart disease. Why? Let's look at B, restrictive cardiomyopathy, preserved EF, beriberi and anemia are high output HF. Okay, let's discuss the types of heart failure. There are 3 types of heart failure. There's systolic heart failure, or heart failure with reduced ejection fraction. And there's diastolic heart failure, or heart failure with preserved ejection fraction. And there's also high output heart failure. Let's go to the first one, systolic heart failure. In essence, it's because of problem with pump. So, the pumping ability of the heart is decreased. And it's often seen in coronary artery disease. Why? Because in coronary artery disease, there's infarction. When there's infarction, there's muscle death. When there's muscle death, there's low pumping, low contraction. Okay? Okay, let's go to the second type of heart failure, diastolic heart failure. There's a problem filling. And it's often seen in hypertension, hypertrophic cardiomyopathy, and restrictive cardiomyopathy. When there's a problem filling, there's low or impaired diastole. And when there's impaired diastole, low blood enters heart. And therefore, low blood exits heart. Okay? Let's go to the last one, high output heart failure. Usually, ito ay thyrotoxicosis and anemia. So, the heart equals okay, but there's low circulation, low oxygenation. Okay? Kasi for example, in anemia, the heart is fine. Walang problema sa heart. Pero yung red blood cells mo, severely impaired or severely lacking. So even if there's blood circulating around, wala rin oxygen. Walang hemoglobin eh. Walang oxygen. So, nagkakaroon ka ng high output heart failure. Okay? Alright, let's continue. 174, a patient with lupus nephritis underwent kidney biopsy. Results revealed normal glomeruli on light microscopy but with mesangial immune deposits on immunofluorescence. What is the classification? Little difficult. Recall question din siya. Answer is class 1. Bakit? Class 1, minimal mesangial. Light microscopy, normal. Immunofluorescence, may mesangial immune deposits. Class 2, mesangial proliferative. Light microscopy, abnormal na. And on immunofluorescence, meron ng subendothelial deposits. Class 3, focal, involving less than 50% of glomeruli. Diffuse, class 5, involving greater than 50% of glomeruli. Class 5, global or segmental deposits. And class 6, advanced, sclerotic, greater than 90% of glomeruli. So, imagine mo, dun sa 1, onti lang yung affected. And then sa class 6, halos lahat affected na. Parang yung glomerulus mo na dapat very thin, hollow tubes that are appropriate for diffusion, absorption, secretion, nagiging solid. So, imagine mo yung glomerulus mo naging solid, imbis na hollow tube. Okay? 175, recall question. Anemia in CKD is almost universal at what stage? Stage 4. Okay? What is the goal HbA1c in patients with diabetes? It's actually less than 7. Okay, wag kayong malito ha. Kasi, ang goal natin for glycemic control is less than 7 yung HbA1c. And yung pre- and postprandial as follows. Let's look at the HbA1c cutoff. 6.5 for diagnosing DM. Diagnostics 0.5. Diagnostics 0.5. 7 for glycemic control. Isipin nyo lang 7th heaven. Kung less than 7, you're in heaven. Meaning, okay yung control mo. 177, what is the most commonly involved joint in calcium pyrophosphate deposition disease? It's actually the knee. Okay, let's look at the CPPD keywords. Pseudogout, most often affecting the knees. Positively birefringent, rhomboid-shaped calcium pyrophosphate dehydrate crystals. It's usually idiopathic or associated with hemochromatosis. Look at the 3 P's of CPP disease. Positive birefringence, pyrophosphate calcium, and pseudogout. 178, what is the most common infection site for tetanus in adults? It's actually superficial abrasions. Okay, let's look at the keywords for tetanus. Etiologic agent, Clostridium tetani. Toxin, tetanus spasmin. Muscles affected first, face and jaw. Treatment is metronidazole. And superficial abrasions to the limbs are the most common infection sites in adults. 179, what is the most common etiology of secondary hypertension? It's actually renal disorders. The way to remember this is physiologically the heart and the kidneys are very much related, very much working together to maintain circulation and blood pressure. So it makes sense that the most common etiology of secondary hypertension is actually the kidney. Last for IM, what is the leading cause of sudden death in young healthy athletes? It's actually hypertrophic cardiomyopathy. Let's discuss the different types of cardiomyopathy. There's dilated, restrictive, and hypertrophic. In dilated, there's impaired systolic function. In restrictive, there's impaired ventricular filling. Ventricular filling is diastolic. And hypertrophic, parang may septum hypertrophy, parang obstruction. Okay? In dilated and restrictive, yung ejection fraction mo mababa. In hypertrophic, yung ejection fraction mo actually medyo mataas pa. Yung LV wall dimension sa dilated, of course, dilated. Sa restrictive, normal to decreased. In hypertrophic, it's decreased. LV thickness, ito very thin, no? Thin. Ito increased. Ito din increased. But all of them would present with symptoms of heart failure. Okay? And that's it for internal medicine.